After the age of 30 to 40, we lose about 1% of our testosterone levels, men and women. It's important for both sexes. The market has grown. So TRT, or testosterone replacement therapy, has grown from a few $100 million 10 years ago to multi-billion dollars now. And it's widely used not just to supplement for sexual dysfunction, which is a common side effect of low testosterone, but for other things that include mental health, building muscle, overall fitness, vitality.
And people swear by this. I mean, a lot of people, they do this. They say they feel younger. They say they feel more vigorous. They want to have sex again. They want to have sex all the time. There's an important distinction to make here, though, which is just because you feel younger does not necessarily mean you are reversing your biological aging.
Right. Let's make a clear distinction. We've talked about adversity mimetics. And in the last episode, we talked about the supplements and the kind of things that you can do in your life to mimic that. We want our bodies to be in a state of fear, that times are tough and they need to hunker down and survive. There are other types of things that we're going to talk about, which are abundance mimetics. Testosterone is one. We're going to get to growth hormone as well. These tell the body that times are good to build your muscle, to reproduce, go forth, multiply.
And that's what testosterone is doing. We get testosterone replacement therapy. We are putting a substance back into our body that has been reduced, but which signals our body that times are good enough. It's okay to build muscle. It's okay to run around chasing woolly mammoths.
Yeah, well,
chasing the cave women around.
Exactly. Yes, that for sure. And that benefited our ancestors very well, but it didn't help them long term. What we now appreciate is the body has cycles of want and need and adversity, which is good for the long-term health of the body, and times where things are abundant, times to grow, reproduce, which are great short-term, but probably not great for long-term health and longevity either.
Okay, so let's talk about what actually happens when our testosterone lowers and what happens, importantly, when we put it back. Because this is helping a lot of people with a lot of problems that are coincidental with aging.
Oh, for sure. There have been a lot of studies, millions of dollars and many thousands of people treated with TRT, as it's called. Shelley Basin, who's a colleague of mine at Harvard, has done a lot of these studies. And he's found some improvements, short-term improvements. So, of course, improvements in libido, but also he shows a dose-dependent increase in skeletal muscle mass. So you get bigger muscles. You got more power. You can climb stairs. You can walk further in 6 minutes. Improves aerobic capacity. These are all good things that he sees, but actually it's not all good news. There are some side effects and may actually impact longevity. So some of the risks of TRT, there's worse sleep apnea. You can actually get larger breasts. Little known fact is your testosterone can be turned into estrogen, which is a risk for men particularly. You can have what's called benign prostatic hyperplasia, so a bigger prostate, need to go to the bathroom at night. Shrinking testicles, not something I think many of us would want. And increasing red blood cell protection, which could lead to blood clots. And
if you're already predisposed to prostate cancer, you have cancerous growth already, this could actually aggravate the tumors.
Yes. And actually, the opposite is true. If you look at the history of eunuchs, they live longer. And so it may actually be that supplementing with testosterone is not conducive to longer life.
Okay. So this is an important principle here, and we're going to come back to this a couple of times on this episode, which is just because something makes you feel good today, and just because it might even be medically beneficial to you today, that does not necessarily mean it is addressing the causes of biological aging. It may be fixing something that you have a problem with. It may be improving even your quality of life right now. Long term, that's not the same thing as reducing or eliminating biological aging.
Yeah, let's go back to the main concepts here today, which are that adversity mimetics are great. Things that mimic lack of food and a lot of exercise. But these abundance mimetics are probably a problem long term, even though they make you feel great short term.